Hey Lauren, you're on full screen for me. So your nurse's office looks really good there, nice and organized.
Oh yeah, I moved my desk around, so I'm trying to. Yeah, it looks like a bomb went off in here. We'll get there.
Yeah.
Hello, everyone. I think we have about another minute or so, and then we'll get started. No, Dr. O'Carroll sent me a text saying he would be on the call.
Man. Hey, what's Connor and Riley's diagnosis for their labs?
Precocious puberty.
Okay.
Dr. Blocker, how are you today?
There we go.
There you go.
I'm doing great. Thanks for the invite. I'm glad I was able to join you this time.
Yes, we're glad too. We're glad too. Nice photo there, man. I like the live video. Also like on your emails. I guess is your nickname Haas?
That's right. That goes back to my I think it's uncle or cousin or something that was Haas on Bonanza.
I love it. I love it, and it is it's very cool to have a lead health authority in the county that we can call Haas. Okay, I know a few individuals will be probably popping in, and I'm sure Jeff will monitor that. I see Stacy Mitchell coming in now. Want to go ahead and get started today. Just a couple of things. First, I want to thank Dr. Blocker, the Hood County Health Authority, for joining us. As you may or may not know, as new guidance has come out through TEA, as we begin to deal with COVID cases in our school district, in our community, we're going to have to work closely with Dr. Blocker. All districts in Hood County will be working closely with Dr. Blocker to make decisions on what possible cases mean in our school system and what rising cases might mean possibly for the school district moving forward. So specifically, we're talking, or what we've done in the last couple of days, and I can't say enough about Dr. Blocker's leadership in this and willingness to work with Granbury and Toller and Lipan. But the issue we had was related to close contact. And so originally we received guidance from TEA that if students were wearing masks and one of the students had COVID, that because both students were in masks, we wouldn't have to send both students home. The student that had COVID would go home in quarantine. Other students that may have passed by them in the hall would, because they were wearing a mask or they were social distancing more than 6 feet, they would be able to remain at school, and we would just monitor them. And should they exhibit symptoms, then they would go home as well. However, TEA maybe early last week changed that guidance and took the mask part out and basically put the onus on Dr. Blocker to make that decision. And so in consulting other counties around the state, I think most physicians said common sense will say that if kids are social distancing and they're wearing masks, there's no need to send everybody that happened to be in the same building with a kid that tested positive home. And so at this time, I'd like to turn it over to Dr. Blocker to let him kind of explain where our county is at, what the case numbers are at, maybe some concerns that he has, or certainly some advice he has as we begin to reopen. And then if he wants to elaborate on the close contact, he can do that as well. So Dr. Blocker, thank you for joining us today, and I'm going to turn it over to you.
Okay, I appreciate that, and thanks for teeing it up. I mean, you just addressed the primary concern that's been brought to me so far. That is the definition of close contact. But I mean, there's so many layers of this that relates to coronavirus and protections for our communities and our schools and our students. And I've heard from some of the teachers, I've heard from some of the parents, some of the students independently. Of course, as you guys know, my phone number, my personal phone number is also my work phone number when it comes to public health. So I field all calls from all aspects of the community and leadership, and I'm happy to do so. But when it boils down to it, a lot of the times it really is it comes down to an understanding of what the underlying risk is to either spreading coronavirus or being ill from coronavirus, and what those risk factors are, and then understanding that, how do we do our best to mitigate it and still continue to do things that we need to be able to do as communities, as families, as individuals. And so I spend a lot of my time trying to help clarify the guidelines for isolation, the guidelines for personal protections, and things like that. And so, you know, when it comes to this coronavirus, although it's more infectious and easier to spread than influenza is, at the end of the day, still it's primarily a respiratory spread virus, which means that you can't get it unless you are close to other people who not only are positive for coronavirus, but are actively sharing it through respiratory droplets, i.e. cough, sneeze, congregational singing at church, things like that would cause forceful exhalation, spread those respiratory droplets that we all have all the time in our respiratory tract to other people in the immediate atmosphere or settling on surfaces while you're doing those things. And so that really is the risk of spreading coronavirus. So if you're staying at a distance from others, whether it be fellow staff members, whether it be family members, whether it be coworkers, whether it be students, if you're recognizing that 6 to 10 foot distance, 6 foot is the acceptable social norm from others, then regardless of whether they're sick or not, it's very difficult to spread any type of respiratory illness. Again, whether it's coronavirus, flu, whatever. And then on top of that, if that particular individual is wearing a mask, if they do happen to sneeze or you know, speak forcefully or what have you, then that's going to help with trapping any particles that are coming out of that, again, infectious or otherwise. So that's the real reason for the mask, is to help keep that particular individual from sharing what they're breathing out with everyone else. And then so the best thing, the first and best thing, is to social distance, because again, if I'm not getting close to others, I'm not going to share anything anyway. And then secondarily, if both of us are wearing masks on both sides of the communication, if we have to share common hallways, in and out of common bathrooms, to and from lunch counters and stuff in the cafeteria, whatever that might be, then that helps to provide that extra layer of protection from those respiratory droplets. So that's kind of the thought process and the science behind it. It's not ideal, it's not perfect, but at the same token, putting folks in respirator masks or masks that we would use for healthcare, the N95 masks, just doesn't make sense for the general public, doesn't make sense for trying to go to regular workplaces or schools or what have you. So anyway, happy to continue dialogue with individuals beyond this or outside of this forum. But that's kind of the science and the thoughts behind it. Keep away from other people, and then if you have to be close to others to get work done, go to school, do activities or whatever, then having a mask on as much as possible, as reasonably possible, when you have this opportunity to get close, that helps to minimize risk. So that being said, if someone does happen to come positive with coronavirus, which is all over our community, it's all over every community now, then we don't have to send every single person in that building or every single person in that classroom home for 14 days. Let me revisit where our community is right now and what the current recommendations are, and then I'll hand it back to Dr. Glenn and the rest of the team. So as of this week, the most current information that we have, bringing from all sources, from the state, from our hospitals, from our medical facilities, from surrounding counties, as relates to Hood County, we've had a total of 557 Hood County residents who have tested positive for coronavirus. That's not huge, but for our community, that's been climbing, particularly over the last 3 weeks. We have 158 new cases added to our list since the last report, and that's pretty remarkable. But I want you to understand that part of that includes about 100 cases that came to us from the state of Texas that were self-reported over the last month or so. And I don't have a corresponding test from a local hospital or clinic to go along with those 100 cases. So I have to trust that the state did their due diligence with the case tracking and reporting things like that before they put them on our list, because they just don't we didn't test them here, or at least nobody in this county has tested those 100 cases, but they're self-reported as positive coronavirus and have all been isolated accordingly. So total of 557 cases, 158 new cases. But here's the more important piece that I want y'all to understand. We only have 82 of those 557 that are currently active. In other words, every one of the cases that's either been reported locally or has come to us back from the state was reported or tested positive more than 10 days ago, or more than 10 days before that report, and don't have any other evidence that they're still sick. So although we have a 14-day isolation period, because it can take up to 14 days to get sick if you get exposed to coronavirus. So we have a 14-day isolation period after someone's exposed to a known case. Once someone does test positive, that individual has a minimum isolation time of 10 days now. As long as they're feeling better, as long as their symptoms have resolved, as long as they don't still have fever or other symptoms, they can be back to work, school, what have you, within 10 days of that positive coronavirus test. And we do not currently require or recommend people just to get a coronavirus test just to be tested. There's too much exposure in the community. There's too many question marks that leads to, and that can potentially keep people away from work or school or anything beyond the time that they need to be isolated. Because again, if your symptoms are resolved, if you're not actively coughing, sneezing, running fever, actively sick with coronavirus, you may still have some residual particles in your nose that I could stick a swab up and find it, but you're not sharing it with anyone as long as you're wearing masks. So the mask and social distancing are the key to all of our community activities. And that's, again, leads back to those TEA recommendations, my recommendations, CDC and state recommendations, et cetera, is if someone's actively sick, they need to be isolated in a way. If they have a close contact or a known family member that's directly in contact with them around the time they got sick, they need to be appropriately isolated if we can't prove they were wearing masks all the time. If we can show that folks were actively wearing masks, even if one of those people gets sick, then that minimizes the number of people or number of operations we have to shut down just because somebody happened to get sick in that context. So 82 active cases now, down from 150 a couple of weeks ago. That's huge for our community because those 82 are the ones we know have symptoms that are being told to stay at home or hospitalized or whatever with active coronavirus right now. A couple of weeks ago, it was 150 cases. When Dr. Glenn and I talked, again, this was 2 weeks ago, and he said, hey, what's our threshold? Do we even open schools or not if we've got 100 or more cases? I said, we're in the thick of it right now. You have to look very carefully at that. Now we're trending back downwards as a community. We're down from 150, 130 down to 80 cases or so. I personally, think that's going to be manageable and reasonable because, again, that's across our entire community. As long as folks are social distancing where they can, wearing masks where they're recommended to wear them, then at some point we got to call what's acceptable risk to our schools and our businesses in our community. And I think for now that's reasonable and that's a reasonable place to be. We've had a total of 10 COVID positive deaths across our community, which isn't huge considering we've been dealing with this for 6 months, but still that's 10 folks who have lost a family member in our community due to coronavirus. And we know that our communities just a few miles away in Dallas-Fort Worth, or even like Weatherford and Cleburne and places like that, have had a much greater impact. And we're close enough that I still want to keep an eye on that. And I'm still concerned about, because we all, again, live, work, play back and forth between Granbury and Dallas-Fort Worth when things are normal. And there's some degree of that still going on. Bottom line, 82 active cases right now, 465 of 557 that we know about have recovered. And overall, our community is doing as well as any community can be right now in terms of coronavirus and contact. Dr. Glenn already did a great job of explaining our definition of close contact. We've already talked about that in context of exposures and risks. And so, from that standpoint, I'm here to support you. I'm here to support our community. I have kids myself that have been, actively involved in both the junior high and the high school side of things with Granbury ISD. Very much interested in doing the right thing for our kids, for our families, for our community, understanding that, every kid going to school has a multi-generational impact, both with other siblings, with parents, with grandparents, lots of times. And so we are all in this together, and you know, we got to make the best call we can to return things to as much of a normal situation as possible, or a new normal, and still get stuff done. So anyway, that's my recommendation. That's where we're at right now. Dr. Glenn, others, I'll open up for questions right now, but I recognize that there's other stuff y'all need to talk about. So I'll just be available and monitor if there are.
Now, and again, we really appreciate you being here, and just so grateful for your leadership in our community, and know you have a lot going on. You touched on active cases, and I know that's something you monitor closely, is the active cases, not necessarily the positives, because that number can be a little misleading. Is there a threshold, like in the community, where maybe a red flag would go up and you would say, wow, we're now at 600 active cases, which would be close to 1% of the population, where you would say we really have got to start backing off, or maybe adjusting what we're doing? Is there a threshold, or is it something you just kind of have to monitor daily?
Dr. Glenn, we do have to monitor this every day, but no, I have intentionally not set a specific threshold. What I can tell you is that at the point in time where we have 100 or more active cases in our community, there are impacts throughout the community. And I told you a couple of weeks ago we were at 150, and then it takes about a 2-week cycle to really know what the impact, you know, what that impact is. We're trended back down to less than 100 now, 80, 82, as of the last couple of days. With 100 to 150 active cases in our community, we have had cases, positive cases in just about every elder care, assisted living, nursing home type facility here in town. We've had cases throughout our different governments and businesses, and because again, everybody's related, everybody lives and works here in a small community. So the kind of working threshold I'm using with the county officials, the county authorities, is 100 cases as being our biggest trigger. 100 or more being the biggest trigger for what are we missing, what else do we need to do, just because we've simply seen that level of impact across our community with 100 or more cases. This week, we've trended back down into the 80s. And this is kind of following in waves too, from what we see across the Metroplex, as being one of the largest, you know, metropolitan areas in the United States, right? Over 7.5 million people in Dallas-Fort Worth writ large. And again, a lot of cross work and play and activities back and forth. So we are seeing a downward trend in the Metroplex in numbers of cases, numbers of deaths, number of active cases. And I expect we'll continue to see the same thing here as long as those trends continue in our nearest large city. So if we're going to make the call to when to go back to school and try to make this happen, I think now is the best time to call it. And I recommend that we work closely, you know, situation by situation, case by case. You know, if there's a specific concern in a particular classroom, particular school, particular activity, you know, we got our different UIL activities that include, you know, singing and band and indoor and outdoor activities, all the sports activities and all the stuff that goes along with that. So I recommend we look more closely at those specific areas if there's a specific concern and deal with that, versus trying to make a call for everybody and everything, you know, being closed down, yes or no. That's my best advice to you. And I think that will help us to continue to provide as much support to the community. It means more work for us than just say, hey, beyond a certain number of cases, everything closed. But I think that would be the wrong call for our community to have too large an impact and be too much of a knee-jerk reaction. I mean, that's my best medical opinion. No, that's great. And just so everyone on the call understands, the guidance from TEA is written for Tolar ISD, Granbury ISD, Lipan ISD, and I assume any charter schools in the area. If we were to have a positive COVID case, we will have to notify Dr. Blocker immediately, and then we'll kind of have to backtrack the exposed or the level of exposure to our staff, to our kids, to our campuses from the positive case. Which is interesting because it could happen within the day, where a kid runs fever during the day. They go home, they go get a quick 15-minute test, and then by the within a couple of hours, we're notified, hey, little Johnny has tested positive for COVID. But more than likely, we're going to find out a day or two after the fact. They're going to go home, they're going to get a test. And so then immediately we'll be in contact with Dr. Blocker. We'll be sending notifications out
to parents, to staff members, that we've had a positive test case, and then the buildings will be quarantined, cleaned off in the exposed areas. And then he will work with us to help identify students that may need to leave campus and quarantine based on the risk of exposure. So the partnership is important, it's necessary, and Dr. Blocker has just been so open and gracious with all the school districts, and we appreciate that. Does anyone have a question for Dr. Blocker? Because I noticed he was eating his lunch, and I want to let him be able to get some of that eaten before he has to get back to work. But if anyone has a question, then they're welcome to ask. Shannon?
Sorry, I had to unmute. I do have a question about social distancing and what the expectations of that are within the classroom. I teach 4th grade, and most of my students are 8 and 9. And the way that the mask mandate was explained was that children under the age of 10 are encouraged but not required to wear one. So like with the way that we've got it situated in here with the class size that I'm projected to have, what exactly is social distancing supposed to look like? Can I still small group? Can they still sit next to each other? Like that, there's not a lot of space in here. I just wondered.
So I appreciate that. Again, the devil's in the details with all this, right? And that's why exactly every classroom, every function needs to look at that, what that means for them with the space and with the student age and the activities they need to do. The recommendation and the risk, the greatest risk is if folks are within 6 feet of one another. And so that's where if you have small groups or other things, even if they're for short periods throughout the day, closer than 6 feet for a period of 15 minutes or more is the guidelines on this as far as what's considered close contact. So if you have an activity that requires students to be closer than 6 feet to one another for 15 minutes or longer, then the only protection we have at that point is to have them wear masks during that activity in that period. Even if they're not all necessarily keeping them on the rest of the time at their desk throughout the day. So that's the time where you have the highest level of risk and need to have the highest level of attention to, as a teacher, the one responsible for those students, because if you are not able to guarantee that, then we end up with a positive test and one of those students or a close family member, then you may have potentially just taken that entire small group, that whole part of your classroom out of play for 14 days. So, without walking through your classroom specifically, I can't give you any more specific guidance, but that is what we're facing. That's what we're looking at. And again, I recognize with younger students, that's a particular challenge that has to be dealt with and has to be faced. But that's my best recommendation on that. The other important piece I want to bring up in reference to this and what Dr. Glenn was talking about a minute ago is that you guys, your nurses and your team that's inherent to your various school are extremely vital to understanding not only is what's going on with this particular student, but if we do end up with symptoms or positive tests or what have you, those school nurses and administrators are going to be your first line of defense to help you and me both understand what exactly was the exposure, what exactly was the risk, what exactly was going on during the day, in the classroom or those various activities, so we can make the best recommendations about how many might need to isolate, how many might if they develop symptoms, might need to get further testing, et cetera.
Yeah, thank you, Dr. Blocker. Appreciate that. Any other questions?
Dr. Blocker, this is Jeff Metter. I'm the communications director. It seems like there's been less emphasis on contamination from surfaces than the airborne contamination. Can you speak to that?
Absolutely, Jeff. Thanks for the question. I mean, this goes back to what I started with. I mean, we all have limited bandwidth, right? And then stuff starts falling off the radar or what have you. So basic surface sanitation, basic hand hygiene are always important. Okay, they're always important regardless of whether you're dealing with coronavirus or GI illness and diarrhea and things like that. I mean, again, it seems like that should be part and parcel to us as adult behavior. However, we have all been to restaurants and been using a restroom in a restaurant and seen somebody else come and go from the restroom and not even bother washing their hands and go right back to eating their food. So that the things that you would think were common sense in our community aren't necessarily common sense, but yes, cleaning surfaces, hand hygiene are extremely important, but it's not just for coronavirus. Those are already there. And that's why I spend more of my time talking about the respiratory piece, because that's the specific way coronavirus is spread. And then if it is on a surface, we still don't exactly know. We know that coronavirus can be found on a surface, depending on the surface. If it's a non-porous surface, sometimes it may linger for a day or longer. Other surfaces may be absorbed more rapidly or be removed from the environment more rapidly. And part of that depends on heat and environmental conditions and things like that. But at the end of the day, I can clean a surface. Just about, we have an EPA approved list of surface cleaners that work against coronavirus and these other SARS viruses and most other common viruses like flu viruses. And just about every commercially available product, just about any hand sanitizer, alcohol-based hand sanitizer will effectively kill the virus on the surface of your hands. Clorox wipes and just about everything else that you might use to clean a desktop surface or a tabletop surface or what have you will work effectively against coronavirus and most other viruses these days. So the surface cleaning and hand washing remain important, but the thing that people are more at risk of if they're already washing their hands and things is that close contact and that respiratory connection, and specifically with coronavirus. So that's why I spend more time talking about that.
Thank you. Anybody else for Dr. Blocker? Dr. Walker, thank you very much. We'd love for you to continue to stay on the call, but I also know you're very busy, and if you need to drop off, we understand that. So very much appreciate all you do for Hood County and certainly what you're doing for the school districts during this time. And again, I'm sure we'll be in contact. We know we had a staff member today who had symptoms. And I know we have two other, Dr. Watts and Dr. O'Carroll on the call. One issue that we're running into is individuals who have symptoms. So maybe we have a staff member who says, I have a headache, I have a stomach ache, my body aches, I'm running a low-grade fever, I'm going to go home, I'm going to isolate. And then we have other staff members that are like, we need to throw out a blast to everybody and say, wow, Jeremy Glenn is self-isolating because he possibly has the coronavirus. And so our caution there, and I'd like to hear you guys weigh in, is that before we blast that out and say our head football coach or a history teacher possibly has COVID, or they're experiencing symptoms of COVID and we're sending them home to isolate. People have HIPAA rights, and we can't just push all that information out. And so can you give us maybe a little guidance while I got both of you on the phone? I don't know if either one of y'all want to jump on that. You may have to unmute.
Yeah, can you hear me?
Yes.
Yeah, I think that kind of the standard of what we're seeing, I don't know, you look at any public institution right now that's back up and running or dealing with these issues is that has to remain private unless that patient, gave their consent to you putting it out there.
And is it, from your expectations as a parent, would you be concerned if so? I know you have a child at Mambrino, and so if a fifth grade teacher, which is not in the same grade level as your child, just has symptoms and just says, I'm going to go home because I'm running a low grade fever and I'm coughing a little bit, no positive test yet. I mean, would there be an expectation that you'd be notified?
No, I think you would. What I would suggest is limit that to the people that were known to have been exposed, so that classroom and maybe any other teachers working closely with that teacher. But even ideally without notifying of names or specifics, just say, here's the situation. You may have been exposed today. We're waiting on test results, but those are the people that may need to know. But you're going to run into the social media aspect of that being amplified.
And our thought, and Dr. Watts, feel free to jump in here. Our thought was, let's just hypothetically say it was a football coach. That football coach could just send the email himself and say, you know what, I went home today, I wasn't feeling well. I want you to know that I'm going to go in and get tested. At the point where I get the test results back, y'all will be the first to know, because I was in first period athletics with you today. I mean, does that seem reasonable?
Yeah, I think if that person's willing to do that, that's probably a good approach to, make it more personal and less institutional.
I definitely think that in this case, more information is going to be better, because just like things we've dealt with in the past, at the school, they fly through social media, and then, you have a million phone calls as to what's going on, who's got it, that kind of thing. And so, I mean, I really feel like, in this situation, everybody kind of understands the importance and the urgency, and the fact that, I think that's been one of the things that has made parents more nervous, is just the confusion of the variety of information that we've gotten, and the fact that, if you turn on the news, you can get a different story from, 3 different newscasts. And so I feel like, if the school could, as much as possible, inform the parents. And I mean, I personally don't think it's unreasonable for a teacher that goes home, or if they eventually do test positive, I don't think it's unreasonable to ask teachers how they feel about signing basically a HIPAA release form. So it releases the school, but I think that those parents are going to need to know. I think otherwise you're going to have a huge amount of scared parents, frustrated parents, that kind of thing. Whereas if we can just give them the information up front, if it's okay with that particular person, then I think that calms their nerves a little bit. They know exactly, who it was, who they were dealing with, and if that is something that affects their kid or could possibly affect their kid. Otherwise you're going to have them, well, I don't know if they were with them, or maybe they were, and so I'm just going to keep them home, for the next 14 days because maybe they were exposed. So I don't know. I mean, I do feel like that's a question maybe to ask, as far as if the teacher feels comfortable, releasing the information. I agree. I mean, the personal email definitely always goes further than anything else, but that personal email may just go to those players, that were in the first period, but who was with him in after school practice the day before, if there were more people there or something like that. I think we have to kind of look at that as to the broad group that he may have, been exposed to.
But basically, anyone within that time frame of when symptoms first they start experiencing symptoms, so they may have to backtrack, and it may be a rather large group.
Yeah, because we know, I mean, they can be positive 2 days before they start showing symptoms. I mean, they can be infectious. So unless that's something that's changed, but so we know that it could be more than just those people that immediately when he started with the symptoms that he exposed.
And kind of the last question while we have both of you on the phone. So as we gear up and I'll open it up, Carl, for questions for both Dr. Watson and O'Carroll. Any other kind of, and I hate to say last minute, but we are getting close to school coming back in person next Wednesday. But any other suggestions or thoughts or advice, things that we need to be considering before we come back for in person on Wednesday with students and obviously staff started today? Any considerations or thoughts you would have for us?
I mean, I personally, I'm very pro-mask, and just my experience with my patients here. Yes, a 2-year-old's a little tough to get to wear that mask, but my 3-year-olds on up have been pretty good about it. Some of them have fought it some, but I mean, I think when you get on up into the, 5 years and up, they've been able to do it, and I think sometimes we have low expectations for maybe what our kids are really capable of. And also just the fact that, as much as we hate peer pressure may be a good thing in this environment, that if that kid over there is wearing their mask, then, the other 5 kids looking at him may decide, oh, I want to wear my mask too today, So, I think even though we're not requiring it in that younger age group, I think it still should be encouraged, as much as possible, not just when they leave the classroom, because I think it's going to be super hard to keep those kids 6 feet apart in the younger, in that young age group there. So, I think as much as we can still informally encourage it, it would be good, if we don't want to put it in writing. So, I think that's just one thing that I would say. The other is that, we've started getting a fair number of phone calls from parents asking us to write notes that, their kid can't wear a mask because, one family doesn't believe they should wear a mask because you're just breathing your own air back in, and that's not healthy. And, then there's lots of them that are like, well, they're going to be constantly touching it and messing with it. And, I've just kind of tried, my partner and I both, Dr. Steinman, just really, feel strongly that we should try not to make accommodations for that. And also, I've just tried to encourage my patients that have been in here and the parents have expressed it. Let's start practicing, sit there and watch a movie tomorrow while you're at home still, and put your mask on and try to keep your hands off of it. It's not going to be perfect, but I think, as Dr. Blocker said, those are our 2 defenses really, is just the mask and the 6 feet apart. And so I think we just have to really try hard for that to happen.
Thank you. Dr. O'Carroll?
Yeah, I would absolutely second that. Dr. Watts has the luxury of seeing how kids react in their clinic to wearing masks. I don't get to see that in my clinic, but I see it with my kids. And I have a 7-year-old that you put it on him, his brothers are wearing it, he's good. That's going to be, it's that peer pressure and that group think of the kids that, if that's what everybody's doing, that's what should be done. And there's going to be a few outliers, but I think it should be encouraged in the classroom. I think it should be encouraged to the extent that you can. And I see nothing but, ages 18 and up, and the worst people for it are adults. They're the ones that can't tolerate and, put it on wrong and mess with it all day. Kids I see look fine with it. They just roll with it. So, there's going to be times when that's not possible, but I do think it should be something that the teachers should try to reinforce through the day.
Awesome, thank you. And yeah, we do have a large supply of masks, and Hood County Emergency Management Coordinator Jay Webster has a stockpile of them. And in addition to that, I know that Mr. Holmgren is working with local entities to provide like clip-on lanyards, so the kids will be able to kind of clip their mask to their lanyard. And so if they're in PE, they're not stuffing it in their pocket or dropping it on the ground or setting it down. It kind of stays on them all the time, and they can just pick it up and push it down. But Carl, did you have a question for Dr. O'Carroll or Dr. Watts?
Yeah, just real quick, just some parents have been asking and some staff members about clothing. I know that the scrubs thing was kind of coming through. Just some clarification on good practices for what we're wearing here at school to make sure that, so that doesn't happen. Is there a difference? Any suggestions, stuff like that?
Dr. Blocker, do you have any like official CDC guidelines on that? Because I think it's just wash and wear as normal, right?
Yeah, that's correct. If you're talking about risk of the spread of coronavirus on clothing, that kind of goes back to what I was talking about before about cleaning surfaces and the like and exposures. Probably just as or more importantly is actually the reusable mask issue that ideally, if you're using any type of reusable mask, or the kids, those should be washed on a daily basis. And that goes back to keeping the bacteria and germs and things out of the masks, which is much more of an issue than spread onto our other clothing, with the exception of if somebody sneezes or coughs into a sleeve or something and they're not wearing a mask at the moment, obviously, then you have a higher potential concentration there. But your soap and water, your detergents, are gonna do a good job as long as you're doing a normal wash and clean cycle on most of your clothing materials. If you have specialty fabrics that require specialty treatment or what have you, well, you know, if you like to wear your silk blouse to school to take care of the third graders, you may not want to wear that silk blouse for a while. You know, I mean, but again, normal wash and wear will take care of removing viruses, soil, other contaminants from you know your most articles of clothing. The other exception was if you're always wearing a certain piece of outerwear, a jacket, a sweater, something like that. Again, you need to make sure that you're washing that as well. And a lot of times people don't think about that. May change our underlayers, but always put on the same, you know, Mr. Rogers sweater every day in class. Maybe we should change the sweater or wash it or get another duplicate and swap every other day. But that's what I'd recommend there. The other piece I want to say real quickly, though, reverting to some earlier conversation about notifications, I think I would caution making a requirement for adult staff to have to notify any and every person that's involved in the class or whatever. I mean, that's definitely, they definitely have the option and ability to do that, but look carefully at whether or not you have a requirement policy that says someone must release their personal information in the time of this health crisis. I can tell you on my end, we do not release anyone's specific name or specific details. And I don't encourage I don't encourage business owners and like to basically call individuals out as the business owner or as the superintendent of the school or as the principal of the school. I would definitely not call out a specific student saying this, you know, little Johnny was sick at football practice. And again, you guys have done a good job with that so far. And I applaud that, but I would just encourage you, you know, again, people are going to do what they're going to do on social media. They're going to be like, well, I know it was little Johnny because I saw Johnny sniffling and he's not at school today. So therefore it must have been little Johnny. But you don't want to reinforce that to ostracize or isolate little Johnny and keep him from being welcome back when his test is negative or when he is well and able to come back to school or work, right? So just be very, very careful about that. Notification piece is important. Singling out individuals by name and by specifics within that notification should not be the standard practice as an organization. You can say this particular group had a potential exposure within 2 days prior to that, as Dr. Watts said, is correct. 2 days prior to the time of the positive test is at risk for exposure period, but I wouldn't call out and specifically name those individuals as an organization.
Yeah, and I agree, and that's within the practice of most school districts, ISDs in the state. That's how it works. Sometimes it's just hard whenever you've got to send an email out to a second grade class, and there's only, I mean, they know that they know who their teacher is, Miss Johnson, and so when you send out notification that hey, your teacher is going home to quarantine, they're gonna know who that is. So, but we would never use the name of the individual, but.
Yeah, but Superintendent Glenn, you don't necessarily have to say a teacher was sick. You just have to say that this classroom has a known positive case of coronavirus, and so for the 24, 48 hours prior, anyone who is regularly in that classroom may have been exposed and needs to be aware. These are the symptoms. Here's the CDC webpage, you know, and talk with your doctor if you're concerned. I mean that's the minimum required information. That's all I'm saying.
No, that's great. That's great. Any other questions for Dr. Watts, O'Carroll, or Blocker?
I have one if it's okay. So secondary campuses, obviously we're wearing masks and that kind of a thing. Our problem time probably gets close to lunchtimes. We've divided it up so that all three campuses have divided it up so that we have 6 lunches instead of 3. So we're trying to, you know, if we can't provide social distancing, that's 6 feet, and they have to not have masks, and someone comes with a positive test, like that's my scary moment, right? For tracing that back for 2 days. So can you talk me through, like, is there something we should be thinking of as far as that's concerned as a procedure that would be reasonable, or am I overthinking that and just saying we're washing our hands, we're hand sanitizing, we're wearing masks through the line until you sit down, and we have 4 people to a table and we've taken reasonable precaution? Like, I'm worried about the tracing on that part.
So Tammy, from a public health standpoint, the other piece I would say is, well, 2 things. First of all, how do you set up?
Dr. Blocker, your microphone muted. Dr. Blocker, your mic muted.
Okay, sorry.
There you go. You're back.
I've got other calls coming in that were covering me up. Okay. So can you reasonably consider that those tables are at least separated 6 feet away from the next table over, so you minimize that exposure to those 4 students at that table? That's the first piece. And you can keep the students from pushing those tables together or whatever. All right. So then the second piece there is you need to decide whether or not you're going to assign lunch tables, whether or not it would have been the person they normally sat together with, at least for this time period. These 4 students are always the ones every day that sit at this table. That's the only other way that I can say from a process mitigation standpoint. At least you can say only these students sat at that table, so that limits that particular lunch risk to those 4 students. That's the best advice I have for you on that one.
Yeah, and as it comes back to tracing, that's probably something we need to consider on every campus and on our school buses, as well as the assigned seating, so we can identify who was exposed. Just real quick, I want to jump to Mr. Holmgren. Will you give the committee an update on the number of students we have registered in person and virtual, kind of what the percentages are, and anything else you want to add about protocols and procedures?
Absolutely. Hey, thanks for being here. We put together the protocol, the reopening, the roadmap to reopening document that we sent out to you, I think about 2 weeks ago. Really haven't made too many changes. There have been a couple of modifications that the Texas Education Agency pushed out, and we've added those and put that in there. So, but not a whole lot has changed to that. Virtually, I can tell you our numbers are more than what we anticipated are going virtual. As a district, we're right about 24% virtual. So almost 1 in 4 students and then their families have opted to do virtual education. And so we are working through that. For those of you in the school district, you can imagine, and Tammy and I have been in a lot of contact here. We're trying to redo master schedules in 1 week before school starts. And typically that's completed about a month before school starts at least. And so we're trying to build two separate schools very rapidly, but we're doing it, and we'll make it work. And we're going to open up on Wednesday, and we'll work through that process. We do have, I think we've identified 12 teachers at the elementary level who will be teaching virtually, and they're going to start planning for it actually tomorrow. We're notifying them today. That's how late it is. And we will get them locked and loaded, ready to go. And we'll make it a great experience. We'll do the best that we can and get them going and love on those kids and develop those relationships early on, and just get everybody to have a great school year.
Thank you, Mr. Holmgren. And again, as always, we're using the latest guidelines that we get from the Texas Education Agency and adopting and modifying our policies accordingly. I want to give just real quick, I'd like to leave Dr. Watson, Dr. O'Carroll, and Dr. Blocker a little time for lunch. Any other quick questions that we need to answer, information that needs to be clarified? Dr. Watts?
Yeah, I did. I just wanted to ask Dr. Blocker, because I wanted, we all want to be on the same page as best possible. And I definitely agree with what he was clarifying with what I said. I definitely was saying that if that was a voluntary thing that a teacher was willing to say, yes, I want my students to know, or whatever, that they released the school, because I agree that's definitely not something, so I think it has to be on a voluntary basis. But I want to also just, because I think that would, so if a kid, they get the email that said a teacher in 2nd grade, or your teacher or a 2nd grade teacher went out. And so then we get, the phone calls from all, 20 parents that are in those 4 or 5 2nd grade classrooms. And in 2nd grade, they're not requiring them to have a mask, and they were, sitting in a circle having reading time or whatever. I mean, to me, that is most likely a 6-foot exposure without a mask on to someone who is positive. So my advice to that parent then is that, you know, you keep your kid home because they probably were exposed to that person that's positive. So I just want to make sure that I'm clear and good on all that, because I don't want to be keeping kids home that don't need to be home, but I don't want to be sending them back, because that's going to be the question we get.
No, and our guidance right now is if you're within 6 feet and you don't have a mask on of somebody that has a positive or is a positive COVID case, then you're going home as well for the, and I think the criteria are 10 days, 72 hours of that have to be symptom free. They can come back if they get a negative COVID test, or they can come back if they have a physician's note that says, gives a diagnosis other than COVID. But otherwise, yes, anybody that is within 6 feet of somebody that tests positive for COVID without a mask, they would be going home.
Okay.
And I can show you just real quick, and I know you guys have a lot going on, but I'm going to jump to my share screen real quick, and just you can always just type in TEA coronavirus, and the first link you're going to get is going to be the COVID support and guidance website from the state. And under the first card, which is the public health orders, that's the guidance from the state. And then within that is a public health operational guidebook. And our policies and procedures are all based off of this guidebook. And if you scroll down to about page 10, it begins to talk about what requires somebody to stay home, when they should self-isolate, and then it kind of breaks down the contexts of who should stay home, who is considered staying home, which is a positive case, versus self-isolation, and that is exposure. And then if you scroll down a little bit, well, I may be going the wrong way. I'll scroll back up, and so here's the guidance for actually returning to school on page 12. And what I'll do is I will copy that and see if I can stop my share, and I'm going to jump and see if I can maybe open the chat room, and chat is disabled. Jeff, can you open the chat, please? And I'm just going to paste this link in here so you can grab it if you want it. And there you go. So the link to that public school guidance is now in the chat room if you want it. So any other questions? So what I'd like to do now, first of all, I want to thank all of the physicians on the call. I want to thank all the parents on the call, our trustee Barbara Townsend on the call, teachers. Something I like to do for those of you who need to jump off the call, have other things to do, please feel free to do so at this time. We appreciate you helping provide a little insight as we get ready to gear up for teachers and students coming back. I'll stay on the call along with Mr. Holmgren and Mr. Metter for anyone that would like to maybe talk in depth, especially as you get ready to jump back and share this information on your campuses. We can have more in-depth conversations about things discussed on this call, or maybe other concerns that you didn't want to share with the broader group. So with that, I'll say thank you and goodbye to those of you who need to go, and those of you who want to stay and discuss further. We can get as in-depth as you would like. So thank you again, Dr. Blocker. We really appreciate you being with us today.
Jeremy, I was just going to ask you again, are you still there?
Yes.
Sorry. Okay. So, and I mean, it is kind of getting very nitty gritty. And I mean, I've read the TEA stuff and the CDC and, tried to, put all that together. But so like, I guess the question would be, if I get that phone call from the parent, or my triage nurse does, that, the teacher went home today, they weren't wearing their mask. What is going to be y'all's number for when, if the number of kids that are out, the classrooms that are out, before we completely, say, okay, we're all going home because we've now, lost a classroom in every grade or whatever. I'm just kind of wondering, because I know the criteria, and I feel like what I know, I'm going to tell my parents that I just have this thought that it's just going to happen super fast, anyway, and I just want to make sure I'm not like imagining things or, thinking any different, because like I said, I want the kids to be there, but I don't want to be putting anybody at risk that doesn't need to be.
No, I think that's a great concern, and I can tell you that as we kind of think through this, you know, our leadership team really has a lot of the similar concerns, and we're kind of going through this with the mentality that based on the guidance we have from local and state health officials, from the Texas Education Agency, other districts across our region, that moving forward with in-person and virtual instruction is the best decision we can make right now. But we are not going to be so stubborn in our desire to reopen and have in-person instruction that if the situation begins to worsen, and obviously as we're having conversations with Dr. Blocker, we see those numbers of active cases begin to rise, not only substantially amongst our students, but just in our population in general, because we know, and I have a friend who's one of his daughters caught it and she was asymptomatic, and I think he told me she lost her sense of smell for like 2 days, and otherwise she could have gone out and run wind sprints all day long and never gotten tired. But it's the fact that she was asymptomatic and she was contagious, and she may have spread it to grandma or grandpa or neighbors. And so as we see those numbers climb, I think it's going to be critical that this committee continues to meet and convene and listen to the numbers and have Dr. Blocker weigh in. If we were to see cases rise on a particular campus, so like AES, for example, sees a large spike in numbers, we have the ability to shut down just that one campus for a 5-day period, do a cleaning, and do a deep cleaning, let those kids go virtual, and then flip it back on. However, right now we can only shut down for 5 days at a time. And that's 5 school days, so it could be like a Wednesday to a Tuesday. It's not necessarily Monday to Friday. But we can shut down for 5 school days at a time, any individual campus, and flip them to virtual should we see it just rise on one campus. My greater concern, and I think this is where you're going, is we start back and in 2 months or right after Labor Day, when people gather, all of a sudden the number of active cases jumps from around 100 to 250. And so all of a sudden it's like, wow, we're seeing nearly double the number of active cases since school started back up. At that point, that's where this committee is going to have to make a recommendation to our Board of Trustees. And we do have a trustee that sits on this task force. Barbara Townsend is our vice president. And as Dr. Blocker, even though the state, the Attorney General said Dr. Blocker can't shut us down anymore, that was the original guidance, certainly we're going to lean heavy on this committee, the advice of Dr. Blocker, along with our city council and our county judge, which do have the ability to close schools to make that decision. Does that help answer your question?
Mm-hmm. Yes. And
again, right now we're planning for this committee to convene every 2 weeks, even if it's just a short meeting to talk about the numbers and where we're at, and that'll go into perpetuity until we feel like the committee can disband.
Okay.
Dr. Blocker, thoughts?
Yeah, you mentioned the public health powers that are allowed for the Texas Health Code, and how that in the case of a stated public health emergency, such as this is an epidemic, pandemic, or even in the case of a specific localized outbreak of infectious disease or risk. I mean, there are certain authorities that are given to the local county officials to include quarantining individuals or to isolating personal property, whether it be a particular home or a particular vehicle that's considered to have maybe some type of contaminated material in it, and to impound that vehicle, what have you. However, all of those powers are contingent upon my recommendation with a clear public health risk indication for that individual or that family, that group, what have you, that are then validated through the county judge, supported by the county attorney, et cetera. So at no time during this crisis, the last 6 months, have I recommended that we quarantine anyone, or that we specifically close a specific business or anything like that for risk of spread of coronavirus. And for that matter, even if I did recommend that, our county attorney has made it very clear that he has no intention to support any of said orders, because he doesn't believe those public health orders and laws and rules, whether it's from the governor or for the county level, are constitutional. And so we've been quagmired locally from a standpoint of official, you must shut down type of orders. That being said, there's been lots of conversations and advice to what makes the most sense for the health and safety of the individuals or that are working at that business, that are running the school, what have you. And we've then been able to entrust the community to make the best decision for them. I see nothing different when it comes to this type of school conversation. As Dr. Glenn just pointed out, there's a school board of trustees, their leadership at each campus, and you guys between the teachers and leadership and the parents and the board of trustees, I trust our community leaders and our school leaders to make the best decision to keep the students safe, the staff safe, and to be able to do what's reasonable to continue to provide, education and support to the community. And so I don't see that changing just because the school year restarted. I just see more opportunities for this kind of dialogue and to help to advise and guide you guys as this particular task force and then the formal leadership to make the best choice for that community. And so I'm here with you, and we'll keep moving forward.
Thank you, Doc.
This might be nitty gritty, but just paper in the classroom. Shouldn't have any big concerns about having paper for individual students, not sharing the paper, but then working on paper, kind of turning it. That shouldn't be any major concern whatsoever.
So, and maybe Dr. Watts or Dr. Blocker will speak to contamination on surfaces. One of the reasons this question comes up in educational circles back in the spring, we received guidance as we had like low-tech options. So all students went virtual. Some students didn't have access to the internet, so they did pen and paper packets. And at one point we were receiving guidance on how to make sure we don't touch the packets as we're giving them to students, and then as we're collecting them, basically quarantining the packets a certain number of days, or using disinfectants to make sure that we don't bring something back to our teachers. But it seems like a lot of that has gone by the wayside. I mean, obviously, if we bring pen and paper packets into the classroom, I would think that students could do assignments and turn them in. But open to hear your thoughts or suggestions.
Yes, I mean, I think so. I think it's just going back to, the teacher's going to have her mask on in that classroom, and then she's going to, wash her hands or use the hand sanitizer after she picks them up, so that she's really the only one that's kind of sharing any of the paperwork, I would assume, if we're talking about just like individual tests or something on the desk. So I think, because even in the beginning, going to get your mail was, are we supposed to be doing this or, but, when you look at the list that came out from CDC as far as things that are high risk versus low risk and stuff, I think that's, getting your mail is a low risk thing, just like you're picking these papers up from these kids. As long as you do, your due diligence with your hand washing and not touching your face and stuff while you're picking them up and everything, then I think you're good.
Yeah. The larger risk is sharing. You want individuals to use their own pens or pencils or crayons or whatever that might be, to use their own individual items and keep control of their own individual items, or keep them in the same space for that student, right? So you're minimizing the amount of cross-touching of things that they're touching on a regular basis, or other people are touching on a regular basis. And then we've already talked about common use water fountains and things like that, making sure that there's some type of a water container or water access or something where everyone's not touching the same spigot, everyone's not touching the same things over and over again, definitely not touching their mouth to a common water fountain. So the papers, again, hand sanitizer, hand hygiene, it is a requirement. It should be in place. It's really minimizing the common use items and handing out papers and returning papers, that each student had their own paper. Not really a big concern.
Jeremy, have y'all shut the water fountains down and just required water bottles?
Yes,
Is that
ma'am.
what I saw? Okay, that's what I thought. Okay.
And we'll, for kids that don't have a water bottle, I mean, if a kid's thirsty, we're going to make sure they get taken care of. So
Right,
there's common sense.
yes, definitely, especially in Texas right now.
So, but again, for our littles, absolutely at the elementary level, we're going to spend a little time when school starts back talking about good hygiene and not only practicing hand washing, but making sure we practice it the right way. Because a lot of kids, you've seen them do this in the past, and we don't think anything of it. They run their hands under the water, hit a squirt of soap, and then wash the soap off. And there's really no scrubbing or movement of the hands. It's just like, I want to wash the soap off my hands that I just squirted on it. So we're gonna spend a little time talking about that. Obviously, we'll have hand sanitizer throughout all of our campuses for teachers and students. But more than anything, we do want to encourage hand washing, even over hand sanitizer throughout the day, before lunches, after lunches. And so hand sanitizer is a tool in the toolbox, but I think hand washing throughout the day at all grade levels is going to be critical.
Mm-hmm.
Anybody have anything else? Looking at my calendar, it looks like August 20th will be our next meeting, which is good because that'll give us a little over a week and a half worth of data to look at. So if we, I mean, likely we'll have probably seen a positive case at some point, and we'll be able to talk about our response and how we handled that. And then certainly we're all going to be looking at the numbers in the county to see if spread is increasing or decreasing. I believe by that time, every school in Hood County will officially be opened in-person instruction. So if it's good with you guys, we'll plan on August 20th. Again, that's our typical Thursday meeting at noon, and Zoom seems to work best, especially with physicians on the call. So we will stay with Zoom meetings. And if anyone doesn't, unless there's anything else for the good of the cause, we'll go ahead and end this call. But I want to thank everyone again for participating, and God bless all of you, and Godspeed.
Thank you. Bye.